Yes. Well, the work of contact tracing is done by a lot of different people in different agencies. So local health departments do contact tracing, and there's also been a new state health department team set up for contact tracing. And I would say that all of those organizations doing contact tracing have a lot on their plate and are in need of more support. So if individuals are interested in that, they really need to contact the local health department and find out if they're hiring and what sort of assistance that they're looking for. No, there's not specific public health training or background or degree required. I think people who do that kind of work well are people with good communication skills, good listening skills, who can present themselves professionally, convince people that they're sharing information that will be kept in confidence and be able to build trust. So those good communication skills that someone in healthcare or social services would have from talking with clients who have health needs would come in very handy. So positive cases or positive tests, which indicate someone has COVID-19, all get reported to local health departments. And in Wisconsin, we have a centralized database where we see all of these tests, these positive tests coming in real time. So our goal for contact tracing is to have a conversation with every single person who tests positive as soon as possible. You know, the standard we go for is within 24 to 48 hours. It's not always possible because people are busy, people don't always answer the phone, and in a surge of cases, there can be a backlog. But our goal is for every individual to get a phone call and have a conversation, which is an interview to identify the places that they've been, where they may have been in contact with other people, and the individuals that they've been in close contact with. So this gives public health the information to be able to understand who's at risk of getting COVID-19, so we can help those individuals monitor for symptoms, quarantine, and protect themselves and their family. Yeah, it makes the whole system a little harder when the volume of cases gets high because really to communicate the need to understand people who've been in contact with people with the infection, it's really important that we make those connections as soon as possible so people can be taken out of contact with others. And if particularly a smaller health department in a smaller population area might only have a handful of people, a public health nurse and a team of disease intervention specialists who are doing this work. And they can do their work well when there's a certain volume, but if that volume doubles or triples or quadruples, they can get behind pretty quickly. And then the value of contact tracing when days and days go by where we haven't been able to reach people, that makes the whole effort a little less effective. So that's another reason that these community-wide efforts, the limiting gatherings and the mask wearing to try to decrease the overall number of people who become exposed to the virus are so important and complement contact tracing, which is that individual level supporting the case-by-case activities. Yeah, that's also a good question. Yeah, there's no question that although we've really built a lot of capacity to do testing in communities and in health systems, that there's a real risk that it's not going to be enough when in the fall, a lot more people get colds and flu-like symptoms. For this to go really well, we really need to have everyone with mild symptoms, even the cold symptoms that are pretty common, to get tested to know whether they have COVID-19. Although our testing capacity has gotten increased, I don't know that we have enough tests in all the right places to do that at a high level. So it's still a work in progress to try to make sure that we have new and different kinds of tests that can be done with short turnaround time. So it is a concern. What we're doing at DHS is to try to encourage more labs to offer tests, make people aware of the different kinds of tests that are coming out, encourage pediatrician offices, for example, or other primary care offices to figure out ways that they can streamline processes to get people tested more frequently. So it's going to be something that we continue to work on and try to build bigger and more responsive as the fall goes on. Yeah, So far there, we're still sort of in the lull between flu seasons. To my knowledge, although we have active surveillance, that that potentially is on the alert for cases any day, we haven't started to see influenza virus circulating. That usually happens anytime between October and February is when it starts and peaks. So we don't know that we have much influenza. There are probably always other respiratory viruses, the common cold that can go around. I know there's some people that have had symptoms all throughout the summer that test negative, which presumably means they have some other virus. So I think there's never a period where there's no respiratory viruses circulating, but influenza is really the big one that contributes to a lot of hospitalizations, and that one we're still sort of in the pre-flu season phase right now. I think an optimistic view is that all the things that we're doing to try to prevent COVID-19 could be helpful in preventing transmission of influenza. So I think it's certainly conceivable. I hope it's the case that there's some additional benefit that we don't have as bad of a flu season. It's very hard to predict, though. Every year the influenza epidemic looks a little bit differently. It matches well with the vaccine to a varying degree from year to year, and there's things that we don't fully understand. So we're certainly not, we're certainly not safe from potentially having a bad flu season, but the overlap between how the viruses are transmitted is pretty strong. So if we do all the things that we're talking about to prevent COVID, which is physical distancing and wearing masks and hand washing, it certainly puts us in a good position to minimize the impact of influenza. Yeah, I encourage anyone who has those symptoms, especially new symptoms that they're not used to look into getting tested. People who are allergy sufferers and always have a itchy nose and runny nose at a certain time of year. I think a lot of people can identify that and know this is my allergies. But certainly I think the lesson should be to have a low threshold, anything that's out of the ordinary. If you're someone who gets an itchy nose and sneezing in August and September every year, but you don't have a headache or a sore throat with that, clearly if you get new symptoms that you don't normally have, that should be a sign. I think the environment that we want to strive toward having is one where tests are pretty easy to get and people feel like they can and should get them with really a low threshold of symptoms. I wouldn't say that we're there everywhere, but that's really our goal, is to be able to get that information about COVID testing quickly to people when they have symptoms that are concerning. Okay, well, I appreciate the opportunity to talk with you and to spread this information. People are being asked to do a lot with the mask mandates and the uncertainty around schools. So I think I really am grateful to you for sharing this with your viewers and trying to get good information out to the public. So thank you.